If your eyes constantly feel dry, gritty, or bloodshot, but regular dry eye drops barely help, you might be dealing with ocular rosacea, basically rosacea that shows up in your eyelids and on the surface of your eyes. And the tricky part is that it can look like plain old dry eye at first, which is why a lot of people go untreated longer than they should. Ocular rosacea is a long-term inflammatory condition that can affect the eyelids, the clear front window of the eye called the cornea, and the tear film that keeps your vision comfortable. It is often linked to facial rosacea, but some people notice eye symptoms before they ever get obvious skin flushing or bumps. The most common symptoms feel a lot like dry eye, burning, stinging, gritty sensation like sand, and watery eyes that still feel dry. Many people also notice red eyes, light sensitivity, blurry vision that comes and goes, or eyelids that look puffy and irritated. A classic clue is trouble along the eyelid margin, frequent styes or recurring chalazia, and crusting or redness around the lashes. In more severe cases, inflammation can involve the cornea and cause pain and vision problems, which is one reason ocular rosacea is worth taking seriously. Ocular rosacea is not caused by poor hygiene, and it is not something you catch from someone else. It is inflammation driven by a mix of immune and blood vessel changes that also show up in skin rosacea. A big part of the discomfort comes from meibomian gland dysfunction, meaning the tiny oil glands in your eyelids do not release enough healthy oil, so your tears evaporate too fast. Researchers also discussed changes in the normal microbes living on the skin and eyelids, plus an overactive inflammatory response, which can keep the eyelids and ocular surface stuck in a flare cycle. Just like skin rosacea, triggers can vary by person, but heat, wind, sun, spicy food, alcohol, and stress are commonly discussed as flare starters in rosacea in general. There is no single quick lab test that proves ocular rosacea, so diagnosis is mostly about a careful eye exam and connecting the dots with your history. An eye doctor will usually look closely at the lid margins for visible blood vessels, inflammation, and signs that the oil glands are clogged, plus they will check tear stability and look for surface staining. Because symptoms overlap with dry eye, allergy, and blepharitis, it helps when the exam also includes a quick look at the facial skin and eyelids for subtle rosacea signs. If you ever have significant pain, sudden light sensitivity, or a noticeable drop in vision, that is a reason to get checked urgently since corneal involvement can happen in ocular rosacea. Treatment usually works best as a step-by-step plan that calms inflammation and improves eyelid oil flow, rather than chasing symptoms with random drops. Daily eyelid hygiene and warm compresses are a foundation because heat helps soften thick oil in the eyelid glands and cleaning reduces irritating buildup at the lash line. Preservative-free artificial tears can help comfort, and doctors sometimes use topical antibiotics, short courses of steroid drops, or other anti-inflammatory options depending on how active the disease is. For many moderate cases, oral doxycycline or similar antibiotics are used mainly for their anti-inflammatory effects, not because the problem is a simple infection. Because ocular rosacea often travels with skin rosacea, a combined plan with dermatology plus eye care can reduce flares over time, especially when you identify and avoid your personal triggers. Thanks for watching, and if you want more clear eye health explainers, make sure to subscribe and share this video.